People were told to leave their homes and businesses after a gas leak from a crashed lorry in Suffolk today. An exclusion zone of 600 metres was set up north of Eye after the tanker hit a tree. Our chief reporter Kim Riley is there now.
Yes, here at Langton Green, the operation to remove the tanker is going on right now behind me. But the exclusion zone that was set up right around it, that has been lifted and people have been getting back to their homes. This was a major alert sparked by what was, in effect, just a minor traffic accident.
They were taking no chances. Firemen wearing breathing apparatus test the air around the tanker. Carrying 14,000 litres of liquefied petroleum gas, it hit a tree and a road sign. The driver unhurt, but the alarm raised after people in the area smelt gas. Considerable resources were deployed by Suffolk and Norfolk fire services, including at least 6 appliances and a chemical support unit. Half a dozen nearby homes were evacuated, one couple taken by ambulance to be cared for at Hartismere Hospital. About 100 workers from a nearby business park were sent home while investigations continued. One major complication: in hitting the tree, the tanker had damaged an underground gas main.
Yes, we've had to put a substantial evacuation cordon in for public safety. At the time we believed we certainly had a gas leak. We believed it to be from the truck. On further assessment it proved to possibly be the truck and the underground gas main, so we've had to have a contingency to cover both of those eventualities.
Engineers from Transco were called in to examine the damaged gas main. By mid-afternoon, the leak in the pipe had been stemmed, with no disruption expected to local gas supplies. And with no leaks found from the tanker, plans to send in a replacement to decant liquid gas were no longer deemed necessary.
The nearby industrial estate is back in business tonight, and the tanker is in the process of being lifted onto a truck and taken away. The emergency services have thanked all the people from the businesses and from the homes for their patience and understanding during what have been quite a tense and disruptive few hours. Back to you.
Kim, thank you very much.
A doorman has been cleared of killing a man in Norwich. Philip Ward, a father of 4, died outside the Chicago Rock Cafe on Prince of Wales Road last May after being thrown out of the club. Stephen Hopkins denied manslaughter, saying he acted in self-defence.
21 members of Philip Ward's family were at Norwich Crown Court every day of the trial. There were loud gasps and tears when the verdict was given.
Simply, we are devastated at the outcome of today's trial. Phil's family and friends have been delivered a life sentence which they can never ever be released.
Do you feel like you've been let down by the jury?
Totally.
The 46-year-old died after a night out with family and friends at the Chicago Rock Cafe on May the 29th. Philip Ward was leaving the club at about 2 a.m. He held a foyer door open and Stephen Hopkins told him to shut it. He then escorted Mr. Ward out of the club and pushed him out of the exit. Philip Ward fell to the ground and hit his head, and he never recovered from his injuries. Stephen Hopkins is an experienced doorman. He maintained Philip Ward had reared up at him and he acted in self-defence.
Anyone who understands the difficult job that door supervisors have, often dealing with people on a late night, perhaps in an intoxicated state, must appreciate that it is a very, very difficult job. And obviously what's happened to Stephen has been terrible.
Stephen Hopkins now intends to carry on working as a doorman. His lawyer described it as his passion. And Janet Gadgill, BBC Look East, Norwich.
A man has pleaded guilty to stabbing a disabled woman to death while she was sitting in her car at Harlow in Essex. Jennifer North, who also used the surname Macquarie, was killed outside her home in February last year. Scott Riley, who lives in Harlow, will be sentenced at a later date. The comedian Jimmy Carr has been found guilty of speeding in Suffolk. He was clocked doing 50 in a 40-mile-per-hour limit on the A1071 at Boxford in April 2008. He employed the celebrity lawyer Nick Freeman, nicknamed Mr. Loophole, who's defended Sir Alex Ferguson, David Beckham and Freddie Flintoff in the past. At a previous hearing, it was argued the charge against Mr. Carr should be dropped.
A church in Essex that dates back to the 12th century has been badly damaged by fire. It broke out overnight at St Mary's in Shearing. Today, the vicar praised fire crews who managed to save many of the artefacts inside.
They've been counting their blessings at St Mary's today because, despite a fire, the Grade 1 listed Norman church is still standing.
Hopefully our roof is still sound.
The Harrises were among the villagers surveying the damage.
It looks quite a lot, but they assure us it looks worse than it is. But it's a lot to me and to lots of us, I think. It's devastating, the smell and the black smoke everywhere and the black walls.
I think we, in a way, are so lucky. We could certainly be looking at a ruin today, but we've still got the roof and the walls are on.
It's thought an electrical fault may have started a fire in the roof. The vicar was sorting through priceless artefacts salvaged from the flames, including a monk's stall, at least 500 years old.
The important things largely have been saved. I do believe in luck, but I also believe in God, and I think he's been good to us in helping us with all of the support we've had to come out of this with much less than the total disaster that it so easily could have been. And we're so glad that nobody was hurt and that even some of our bats survived after the fire last night.
But although the church itself was saved, the damage will still run to hundreds of thousands of pounds. Gareth George, BBC Look East.
Well, just a few months ago, we were all bracing ourselves for what was expected to be the biggest winter crisis in the NHS for 10 years. But the swine flu pandemic appears to have lost its bite. The number of people getting it has dropped significantly. So, were we lucky, or were the predictions wrong?
Let's be clear, this has been and still is a major health emergency. In this region alone, 22 people have died. Around 170,000 people have caught swine flu. There are still 37 people in hospital, many in intensive care. Now, this is how the crisis panned out. To begin with, as many as 30,000 a week were catching it. It went down in the summer, and then, as predicted, the number of cases rose when the schools went back, and see how the number of new cases is dropping now. In the autumn, there was a new vaccine aimed at the vulnerable, pregnant women, cancer patients and asthma sufferers, for example. And there's been a good response from NHS staff. Despite shunning previous winter flu vaccines, 32,000 workers have also been vaccinated. Now every child between the ages of 6 months and 5 years is being offered it, but with the public believing the worst is over, it's hard to predict how many will have it. Many sufferers had a pretty mild flu. This virus has not proved as virulent as feared. But for a few unlucky ones, like this mother from Stevenage, it was life-threatening. Jacob is finally getting to know his mum. For the first 3 weeks of his life, Joanne Cockcroft was in a coma, dangerously ill with swine flu, unaware even that she'd given birth by caesarean.
I was heavily medicated for about another 3 or 4 days, so they were bringing in this baby, and I kept thinking, why are they putting a baby on me? Who is he? Why is he here? And because of the tracheotomy, I couldn't speak, so it was all very confusing time, and I was also having hallucinations from the medication as well.
As she gained her strength, mum and newborn were gradually reunited in hospital.
Really quite traumatic, and when she came out of theatre, one of the consultants said to me, look, if she has got swine flu and she's confirmed, if she is confirmed with it, that we're in for a very rough ride. And she was true. we have been through hell, you know, to put it lightly, really.
Now back home, Joanne is making a full recovery. Jacob's oblivious to the crisis surrounding his birth. Dr. Paul Cosford is the Regional Director of Public Health. He's in our Cambridge studio now. Dr. Cosford, we've heard that swine flu cases are dropping off. Why has it not been as bad a pandemic as expected?
Yes, you're right. We are seeing significant reductions in the numbers of new cases at the moment. But we're still running at the moment at about 2,000 new cases each week. And as you said earlier in the report, we've still got somewhere around 40 people in hospital and 15 or so people in critical care. So whilst for the majority of people it has been really a mild illness, there have been small numbers of people who've had particular severe illness, such as the Joanne who you just showed.
The figures you mentioned are interesting because now most people don't actually get tested for swine flu. So could they be muddled up with people who've just actually got the normal flu?
Well, that's always possible, but what we do know from the testing is that the predominant strain of flu that's still around at the moment is the swine flu. And what we also know is that when you've had a pandemic of this sort, that the predominant strain of flu for the next few years is likely to be this particular strain. And that's why it's so important for people who are either in the vulnerable groups or who are children under the age of 5 should still have the vaccine, because this will be a form of flu that is going to be around likely for a number of years yet to come, albeit we won't have the major pandemic that we've had over the last few months in terms of the numbers. And what we do know too in terms of children under 5 is that they are twice as likely as other people in the population to end up in hospital if they do get the flu. So although it is mild for the vast majority and it's not something that people should panic about, it is